Hello, everyone. Dr. Barrett at Vibrant Life Center. Hey, I just want to share with you. We used to do a radio show for years and years, 5 years of radio shows, and we talked about different situations people would get in, from back pain to whatever, menstrual cramps or headaches or whatever. People had, would just talk about how how you diagnose that and what happens medically, and then what you do actually to get better. I'm just reading through this history of a former patient who I haven't seen, and it is just stunning to me. I have to share this with you. There's just stunning. It was in the office when I took over this office in Edina from Dr. Burke. He did introduce me to some patients there. This one I don't believe I've met. I'm not going to share his name with you, but I'll just share this story. Dr. Burke really had a different style of practice than mine. It was very much car accident and pain based, and people would come in when it hurt. You'd come in to see the chiropractor when it hurt. And I'm just going to read you some of this story. And it's really quite sad. The gentleman is 47 years old. And the main issue here is neck pain. The reason I have this note, it was seen by an MD, his MD, in a telemedicine visit. And the gist of it is some history here. And now sees another chiropractor formerly involved with this office. Now sees another chiropractor, which quote unquote really helps with his neck pain. Last saw Dr. Blank in September. This is today, December 14th. Seeing on an as needed basis at this time. I'm just going to say this. Um, you'll find out kind of the condition this guy is in a little bit. But going to the chiropractor quarterly, even if you come, I don't know, every 6 months as needed. How do you know that you need it? What is the tool you use that you need? He goes in for neck pain, I guess. I don't know. Got enough stuff going on. But he has daily migraines. Get that. That's daily migraines. Some other findings: an MRI from 2018, normal. C-spine MRI, normal. But calls anytime for trigger point injections for his neck. Sees a neurologist for the migraines. This phone call, this visit, if you will, is about low back pain and SI joint pain. Has not been getting much relief from lumbar injections, lumbar and sacroiliac joint injections. Also, the 2018 lumbar spine, mild disc degeneration, no foraminal central stenosis, annular fissure, minimal bulge at L45, L45S1, injection done, 80% relief, wore off quickly. Steroid injection done in July, 70% relief for 3 months. As a Boston Scientific spinal stimulator in June of 2020, reprogrammed in September 2020. So I had prior to September, reprogrammed states 3 of the lead contacts were damaged, getting pretty good pain coverage top to bottom, but not in the middle. Just very happy with the stim. Has a really hard time quantifying how much improvement he is getting, but states he's feeling in his left leg, which he's very happy with. After his last visit, we get 2 out of the 3 contacts functioning again. This guy's got left shoulder surgery at another orthopedist, which went well, decrease. He has depression. He's using cannabis, Cymbalta. This list just goes on and on and on, and I almost want to call this guy up and go, dude, how did you get here? You're 47 years old. This is not right. This is terrible. Anyway, this guy's got like 11 diagnoses. The list of medications that this guy has been on in the last 5 years. I'll just show that real quick. It's that long. It's pages long. It's 30 medications long. Unbelievable. That's kind of stuff that, the reason I do this every day, I don't know this gentleman, but somebody knows this gentleman. And I have a saying: when people have this much stuff going on, you're just hanging out with all the wrong folks. If you want to make $1 million, if you want to know how to become wealthy, money-wise, financially, probably don't hang out in the trailer court and ask those guys living in mobile homes how they made their millions. They won't know the answer. and really hanging around folks who treat disease. Very nice that they treat disease and these diagnoses, but that does not create health. Health isn't, getting your stimulator in. Health isn't getting a treatment for your neck pain or your migraines. Health is your body just works right. Well, how are you going to get your body working right this far from normal? He's not one Cymbalta or muscle relaxant or cyclobenzaprine or hydrocodone. I mean, this is heavy duty stuff here. Fluoxetine. I mean, this guy's on a lot of stuff. If I took that list of medications, I would be sick. I couldn't even do my job. There's no way a guy who, was injured at some point and went through all these things for the last, since 2016 can be healthier taking that stuff. The only way to get healthier is to get your body working right again. How does that happen? It happens by turning the system on that runs everything. That system is inside of you. It's your brain, your spinal cord, and your nerves that runs everything. That's how you run. You can't feed it Pop-Tarts every day and expect it to hold up. You can't do that either. You do got to eat well. But I can tell you that even if you eat perfectly, even if you work out religiously, if your spinal cord's jacked up because your spine has got a subluxation messing up your nerves, you cannot be healthy. It won't know what to do with the food that you ate. It won't know how to run your body when you're exercising. That is not health. Health is your body adapting to the environment. That is whether you have a muscle strain or whatever, you got a tennis match you got to recover from, whatever it is. Health is your body adapting to the environment. That's what we show people how to do here. That's what we do day in and day out. The people who come here and do this, by and large, hands down healthier and enjoying their lives way more than this guy. It's very sad. That is a very sad story. 47 years old. 47 years old, you should be at the peak of it. You should be out doing triathlons and doing what you want to do, man. Taking your kids to sporting events and doing what you want to do. This is just really, really sad that happened. But it's happening everywhere. Friends of yours, people like this, you're going to see them over the holidays. People like that, you're going to see over the holidays. Hey, just tell them, hey, I know crazy guy here. We can turn it around if you just do this, this, and this, and this. And we turn that around for people. So anyway, I just wanted to share that with you. If you know somebody like that, have them give us a call. We'll put them on the road to straight and narrow, get them going better. Our Oakdale number is 651-777-3611, and our Edina number is 952-835-0006. So absolutely, help people out, show them how to do that. So anyway, I'm Dr. Barrett, Environment Life Center. We'll talk to you soon. God bless.